Renal cell carcinoma today is a field that's dramatically changing. We're making progress in advanced metastatic disease, but for patients with stage 3 disease, high risk for disease recurrence after surgery, there really hasn't been any breakthroughs until recently. For the most part, that's been an unmet need for patients, and we've done some clinical trials looking at tyrosine kinase inhibitors in that setting. One study was positive. That was the STRAC study, which looked at the use of Sutent 50 milligrams, 4 weeks on, 2 weeks off for 1 year versus placebo in patients with high-risk disease, either T3 lesions or node-positive disease. And in that patient population, we demonstrated a 24% reduction in the risk of disease recurrence for the entire population. And at 5 years, there was an absolute improvement in recurrence-free survival of 8%. So roughly 1 out of 12. In order to prevent recurrence. Overall, for that population, it was about a 50% disease recurrence at 5 years. So this was indeed a high-risk patient population. And this was a positive study, and it led to the FDA approval. But it's interesting to us that in this context, there hasn't been a lot of use of Sunitinib in this setting, and there's been some pushback regarding the results because of some other studies that were contemporary studies that didn't meet their primary endpoints.